Hi, my name is Gabby, and my presentation is on the need for there to be clear and strict restrictions on 3D printed organs. 3D printed organs has the ability to immensely alleviate some of the strain that there is on human organ donations, as currently there are over 100,000 people on the transplant wait list, and every 10 minutes another person is added. While 3D printing organs is an astounding technological innovation, scientists and researchers have acknowledged the ethical dilemmas that coincide with it when regulations aren't put into place prior. Some of these include this possibly being only available for the wealthy, making sure that the necessary clinical trials are put into place prior to being administered to the public, as well as deciding just how much of a person we would like to 3D print. Due to the newness of this technology, researchers such as Alex Socker have admitted that this probably won't be a mass market technology for quite some time due to the expertise that bioprinting requires. Because we do not want this life-saving technology to exclude an entire demographic, regulations must be put in place. They also must be put in place to ensure that medical professionals and hospitals adhere to some of the basic guidelines of health, which is ensuring fairness and equity in all of healthcare and financing, and healthcare outcomes and financing. We want to make sure that this technology isn't taken over by the wealthy and that it is used in pursuant to the betterment of health for all people. Regulations are also needed to ensure that clinical trials are put into place to ensure safety before it is administered to the public. 3D printed organs are very individualized to each patient, so governing bodies such as the FDA need to have responsibility over this technology to ensure quality and safety and ensure that lives aren't lost simply due to malpractice. 3D printed organs also need to be tested for longevity, as they will be in the body for quite some time, and bio companies need to have regulations to ensure that they don't start using this technology before it is ready for financial gain. Since this technology is something that we haven't seen anything like it before, we are not sure just how far it will go once it is mastered. Currently, scientists want to be able to replicate and 3D print every single part of the human body, so we must decide just how much of one person we are willing to 3D print. The Institute of Biotechnology says that we must acknowledge the social risk of human change, and we must ensure that this technology stays a human health stabilizer as it was initially intended, rather than a human alterer. While some people believe that putting strict regulations on technology hinders technological innovation in the future, we must not prioritize technological advancement over human health. Implementing proper regulation and a governing body into this technology will ensure that this technology is utilized to its fullest, while also ensuring that we consider the necessary ethical guidelines for safety. Thank you.